Okay.
So it is December 9th, 2024. It is 7:32, and the Board of Health meeting is called to order. We have a quorum. So were there any additions, corrections to the minutes from last meeting?
We actually, on the agenda before that, we have to do nominations for officers this year.
We'll start with that.
Yeah,
okay.
Yep. Nominations for officers and approve the 2025 meeting calendar.
Okay, so why don't we start with the meeting calendar? So that's been printed, and I think a motion to approve the calendar for the 2025 schedule for the Board of Health meetings.
So move.
Do I have a second? Any concern about that? So could I have a vote on schedule? Meeting schedule for 2025.
Oh, on
the meeting
the meeting calendar
for next year.
For the.
There's been a motion, a second discussion, and a final vote.
So now a final vote. All in favor of the schedule?
All right. Sally, that was a yes. Tracy, that was a yes. All right. Vice Chair and Secretary.
Chair, Vice Chair. So any nominations for Chairman of the committee?
You can nominate someone else, or you can nominate yourself.
Mark, are you rolling off this year, or where do you stand in your term at this point?
I think I am through 2027, I believe.
I don't have it with me.
I can look at.
Okay.
You have any interest?
Oh, no, I mean, I'll do whatever. It doesn't matter to me.
Or Henry, do you have any
But
interest?
if you're going to roll off, I'd say it wouldn't make sense, I suppose, but for you to, stay in chair. But if you already want to stay chair, I'd happily support you. If you're not, then I'm sure one of us will do it.
If anybody else would like to have the opportunity to be chairman, I'd be happy to let somebody else nominate themselves.
Hi, this is Henry.
If you're interested.
I'm happy to serve however, so whatever the board needs, I'm happy to do.
All right.
And I'm chairing or continue as vice chair, either way is fine.
Henry, did you want to say something?
Oh, no, I was just about to say, Mark, if that's something that you're interested in, I'm just like Jason, I'm happy to support you. I've had the privilege of sitting in that chair position, during a pandemic, so everything else is relatively a cakewalk, I would assume. And I'm happy to take on that role as well. But again, I don't want to take away the opportunity from anyone else who might be interested in holding that position.
I'd like to nominate Jason.
Okay, I would accept. Sure.
All right. So we have a nomination for Jason. Any other nominations for chair? And then, so now vice chair, we'd hear nominations for?
Now, any nominations for vice chair? I'd be happy to serve in that role.
I would nominate Mark.
All right. Mark is interested. Anyone else? And then for the position of secretary?
I nominate Henry.
Henry, do you accept that nomination?
Yes, thank you.
Okay. Any other nominations?
Second that.
Okay, so then you would make a motion for the slate of candidates?
Okay, so we have 3 candidates, and I would like to make a motion to accept those 3 candidates for chairman, which would be Jason, vice chairman would be myself, and secretary, Dr. Yoon. All in favor?
Well, you call for a second to
Oh.
to your motion?
Is there a second to that motion?
I'll second it, it's Sally.
Sally seconds it.
All right, so then I can say all in favor of those slate of candidates.
Aye.
Aye.
Yeah. Aye. Aye.
Aye.
Any opposed?
All right, I think I heard all three voices, Tracy, Henry, and Sally, say aye, so.
Yep.
And we have 2 ayes here.
Yes.
Well, congratulations. And Jason, you would now take over the meeting. Right now, yes. No training program, take the training wheels right off.
Here you go, yeah. And just so we know, for the committee, Mary Frances, I don't know if she can continue for the next year, her term ends this
Mary Frances'
24.
term has ended, so.
Yeah. So we're just waiting on them.
And then Carolyn Durgee, her term on the Human Services Commission ended, so she's no longer on the board. And so they're appointing a new person from Human Services, and the Board of Selectmen will be voting on a new candidate for the Board of Health on the 18th of December. And the candidate that's currently up is Dr. Sophia Kurdermi Pendley. She's a PhD in public health who teaches, she used to teach at Sacred Heart, and now she teaches in New York City, I think at New York Medical College, but don't quote me on that. I think it's maybe one of the other ones. But so she's been active in public health preparedness and teaching public health and public health programs in the area. And so, but she'll be before the board on the 18th.
Great.
All right.
Excellent. So next we'll move on to the approval of the meeting minutes. They were sent out in email. Hopefully everyone had time to look at them. I'd be happy to entertain a motion to approve them.
I do approve.
Mark makes a motion. Is there a second?
Second,
Sally seconds.
it's Sally.
Any discussion on the motion? All right, hearing none. Any opposed to approving the minutes as they are? All right, hearing none, the minutes will move forward. They're approved.
Okay.
Sam, next we have your report.
Sure. And so I've got a couple things here that I'll go over relatively quickly. So the big thing that you know, at least in my office and a few of us on the staff have been working on is, you know, the Data Haven. I think I shared some of the results last month. Data Haven put out the Community Wellbeing Survey. We had the Community-Based Needs and Assets Survey returned to us. And so we've been spending a time studying those and converting those to graphics and are starting the process. We'll continue to work on that, but I thought I would share some of it. Just the Monday before Thanksgiving, I did have an opportunity to go up to New Haven to hear from Data Haven themselves, present on the data, including Siena College, Siena Research Institute was there as well. The commissioner of the Department of Public Health was there, and the deputy commissioner, and a lot of folks that were, you know, assisted in the funding of the survey. And so I just thought I'd share over here with some of the results. And I'm sorry, for the folks at home that on the line, they can't see them, but I'm just going over a few different graphics. And what I can do is I'll include these in the meeting materials, and we'll upload them to the website. But so just showing, these are some of the graphics and what is you know, highlights of what's to come for the Data Haven research. And this is just the state level data. And so here you'll see it's talking about food insecurity rates increasing significantly after the pandemic. The pandemic provided a lot of financial assistance to folks. And so, but after the end of that, you see both Connecticut as a total and the families with no kids and families with kids in the home most significantly going up to, you know, close to 24%, indicating that they are food insecure. And part of the benefit of this survey is the breakdown that they've done of various, demographics, if you will. And so this slide shows, again, food security, but it shows, how is it different for people that were incarcerated, people that are transgender, people of different ethnicities, whether you're disabled, born in and out of the United States, a bunch of different variables, and showing the percentages there, and showing that, those who are incarcerated 2 or more times shows the highest rate of food insecurity, just under 40%, indicating that, and kind of shows the depth of the survey because of the numbers, the 7,500 survey responses. You can really get down into the demographics of it. Financial security in it as well, and again, I've picked a couple different variables that they presented on, showing that financial security kind of was heading down, improving, if you will, and then since 2022 or so, or 2021, right in there, since the pandemic, it has raised and gone up, with those earning the lowest income demonstrating, some of them are, 72%, indicating that they're financially insecure. And I think the survey question response was, I'm, barely getting by, and then housing insecurity, again, showing the increasing trend for a variety of demographics, even those who make 100,000, Connecticut on an average 30 to 100,000, and under 30,000, all are trending upward. With people at the highest income kind of returning back to where they were prior to the pandemic, but others just going well above where it was before. And this is showing people missing medical care. And the question was, in the last year, have you had missed medical care appointments, due to a variety of reasons, missed care, or have you delayed it? And so again, you see, on the missed care, just a slight trend upward, again, since they started doing this in 2015. And then delayed care, you see, the numbers go way up during the pandemic, people delaying more care, then coming down, and now it's starting to go back up again, in some cases to about pandemic levels of people that are delaying care. And again, just getting into some of the demographics of it, this is, adults and adults with repeat incarcerations that smoke. And you can see, like, for Connecticut, 12% of Connecticut report smoking. Those who are incarcerated 2 or more times, it's 35%. Some of the higher ones, those who are disabled, indigenous, 27%. And so and again, this is the statewide data. We have this for Fairfield, so once the final report comes out, it'll sort of contrast Fairfield against the state and other similar towns in the region. And this one slide shows reported levels of trust in institutions. And so the variables are local health officials, healthcare workers, local police, law enforcement, state government, local government, federal government, with federal government demonstrating the lowest level of trust, currently in 2024, with less than half of the people saying they trust the federal government, where local government in 2024 were up around 65%. State government is down to about 55%. Local police goes up to about 80%, high 70%, and then local health officials, people report the highest level of trust, with local health officials being slightly higher than police at probably around 80%. But that trend has, if you look at the past the slide presents data from 2020, 2021, 2024, showing that trending downward for local health officials and healthcare workers. And so this is some of the local data. So this is from the Community-Based Needs and Assets Survey. This is 1,100 Fairfield residents, a convenient sample, so people just basically self-selected and chose to do this, but showing, you're asked, have you been told by a doctor or health professional that you have any of the following with high blood pressure, diabetes, angina, coronary heart disease, a heart attack, none of the above, or prefer not to respond, and showing that, for those on the phone, the hypertension shows about 50% of people over 65 answered that, and it goes down to about 10% with diabetes, but she's, and then lower than that for angina or coronary heart disease and heart attack. But just demonstrating sort of the level of which we get down to into the demographics. It shows it broken down by 18 to 34, 35 to 64, 65 and above. And here's one, this is Fairfield specific data. Have you ever been told by a health professional that you have asthma? And it shows the rates for 18 to 34, 35 to 64, and 65.
Mary Beth.
Hi, Mary Beth.
Hello.
Showing, about 27% for ages 18 to 34 saying, yes, they've been told by a health professional that they have asthma. And, using that same, on that same chart, it says, 73% said no, they've never been told they have asthma. And then it goes deeper in saying, if you did say yes, do you still have asthma? With, about 35% of those who said yes saying they don't have it anymore. So it's, an indication of, yes, they were told at one point in their life they had it, or they had it as a child, and they've no longer have it. So just interesting variables looking into this. And another interesting one, how often do you get the social and emotional support you need? And the variables are always, usually, sometimes, rarely. And so, it's showing that, the most people say either always, or usually they get the social and emotional support with sometimes and rarely being a bit lower than that, less than half. So again, just demonstrating some of the types of data that's available to us now at the local level, and then also at the state level that we can compare with. One of the last ones I think is this: during the past 12 months, was there any time that you needed mental health treatment or counseling for yourself but didn't get it? With for 18 to 34, with about I want to say that's about 35% saying yes for 18 to 34-year-olds, 4-year-olds, and a little bit less, with around 15% or so saying for ages 35 to 64, and then very small ages 65 and older saying that yes, they did not get the care they needed, mental health treatment or counseling. And so I thought I would show you just if you're into data, you can go to datahaven.org, and they have what's called the Connecticut Town Data Viewer. And so with this, you can simply pick your town or the state or different. They even have different sort of catchment areas, if you will. They have, like, our area is Connecticut MetroCog. They've got different areas there, but if we scroll down, you can kind of, so if you're looking for local data, let's get it here, you can pick from a variety of different topics. So if we pick, health outcomes, I think we've talked about this. And one of the, interesting things, is it shows the specific data for Fairfield, and let's pull up asthma, current asthma rates. 4.5% of Fairfield residents, we're still looking at asthma. Oh, okay, it's got it here. 9.9 have asthma. The chart here is showing asthma. And this kind of gives you a chart of the state, and you can kind of see how you compare with Fairfield at 9.9 being one of the lightest, colors and lowest rates. going up to 13 to 14%. You can kind of see in the state how the state fares in terms of asthma rates across the state, and then it also gives you state data for all those variables in that category, and then you can compare it to other towns, other cities. So I just find it an interesting way, if you're looking for a particular variable, to get some local data on and be able to compare it to other cities and towns or the state. It's a great tool, and it produces these graphics that you can get, and you can either switch it to a chart type of graphic that you can import these types of charts into your presentations or grant applications. So I will move on to just our respiratory viral disease dashboard for the state, showing kind of COVID coming down to its lowest level since August, and then flu and RSV staying relatively low, but just starting to trend upwards. You can kind of see down here in this chart here, just starting to trend upward while COVID's coming down. And then the different individual ones, you can see influenza has been steadily climbing. This last bar is usually incomplete data. RSV doing the same, kind of trending upward. COVID coming down since sort of last week of September. Again, this is just another view of that. This is weekly ER visits for viral respiratory illness, tending, with COVID coming down, RSV and flu sort of just starting to trend up. And then you can see here sort of vaccination rates. This is the COVID vaccination by week, with most people in the middle of October getting 47,000, 46,000, 45,000 vaccinations per week, and then it does a breakdown by age. RSV vaccinations, we've got about 190,000 people vaccinated in Connecticut over different age groups. And then influenza showing the same thing with a peak in the middle of October, with a total of 1,060,000 people getting influenza vaccinations so far this flu season. So anyway, so I just sort of share that we are going into a prioritization session with the members of the Health Improvement Alliance in our area. So we'll have a session on January 28th at St. Vincent's Hospital, where all the members of HIA and other people that are interested will be sort of presented a summary of the data and look at what issues do we want to prioritize, and then those issues will be handed down to different task forces, work groups in the group, and then they will lay out objectives that they want to achieve, and then put in place a health improvement plan to achieve those objectives. So it's taking the community health assessment data and then reviewing that and then prioritizing those issues that came out, that stuck out, and then putting that into a health improvement plan, and that'll guide the activity of the group as a whole, and as well feed our next strategic plan as a part of that for the health department here.
Well, I was going to ask, actually, in your first few slides with the various insecurities, I was going to ask if you had any kind of data on, maybe qualitative or quantitative, as to where the insecurities are coming from and why they're all rising now. I mean, we can assume a number of things, right, inflation, et cetera, but did anyone give any more concrete information as to maybe what's happening that's leading to some of these? And, this way, as a community, we can act upon it and help.
Yeah. We're starting, and some of the questions have several layers of questions underneath it. So like things like, why did you miss your last mental health appointment, or not get the care that you need? And it asks about 6 follow-up questions that show, kind of hammer down of exactly why. So that data is available for some of these. I'd have to look at the food insecurity one a little closer. We've been sort of focusing on the health variables, but some of those have that kind of depth to it,
okay.
And so we'll continue to look at that.
Since when is that meeting at St. Vincent's?
It's January 28th. And I can send you information if you want.
Yeah.
Okay. And so we continue to participate this past week. And so between last month's meeting and this month, it's only been 3 weeks, with about a week that was holidays and things like that. And so it's not a lot of time, but we've been participating in both regional, state, and they had a national MRC webinars talking about, progress and changes in the Medical Reserve Corps. The state did convey to us that, we'll no longer be doing travel monitoring of travelers from Rwanda due to the Marburg virus outbreak. We are now in a 42-day period, waiting for a 42-day period with no new cases, and once that happens, they'll declare the outbreak over. But because there are no new cases, the CDC is stepping back from the extensive traveler monitoring they were doing, and have said that, for the current travelers, they will just monitor themselves, and the local health departments don't have to do that. We did have an opportunity this past week, all the department heads for the town and the first selectman, to meet with the state legislators for our area, Representative McCarthy, Representative Leeper, and Representative Keat. That came together. We met for a good 2 hours and talked about sort of this, what's likely going to happen this session, the structure of it, how bills and laws can be introduced through them and through the different committees, and then had a discussion simply about what some of the departments are dealing with in terms of significant issues that require some legislative leadership and potentially some changes in laws and regulations to bring about those changes. I'll give an example of the public works director is, everybody's struggling with recycling. That since they switched to mixed, single stream recycling, everything gets combined, and there's a lot of what they call contamination in it, just things that are in there that shouldn't be in there. And so the Chinese government that used to buy a lot of that has said, well, your recycling is now too contaminated. We don't want to buy that. And every town and municipality throughout the country is struggling with this, and so they're trying to suggest legislative approaches, changes to turn away from single stream and create real opportunities to recycle items like glass, specific types of plastic, and not have, because now everybody thinks they can throw everything into the recycling bin, and as long as it's plastic, it goes in, and so there's a lot of contamination, and just that mixed nature of it makes it more challenging. And so that's an example of one of the concerns that, lots of towns used to generate revenue from recycling, and now they're all paying for it. And a lot of the materials that are, supposed to be recycled because of the contamination simply have to be treated as trash. And so then they have to pay for that as well. And so, some of the challenges like that. And lastly, I want the board to know that their vote last month was confirmed, that both the first selectman and the commissioner of the Department of Public Health agreed with you and approved me to be the director of health for town of Fairfield for the next 4 years. So thank you for that, and that's the quickest turnaround I've ever experienced with getting it back that quickly. Usually it's a month or two, but to have it in place is one less thing to worry about, and move on and continue to do our work. And that's my report.
Congratulations.
Thank you.
Thank you.
Very well served.
I will turn over to our new Assistant Director of Health from nursing.
So I'm Sarah Payne. I've been here about 3 months in Fairfield. It's been a busy 3 months. I've really focused on trying to get to know the staff. There's 26 schools, so getting to know all the ones like Umpqua and all of the names of them all. I have a great group of nurses that are really dedicated to the students, go above and beyond, and a lot of them have been here a long time, so they've been a good help for me as I've been stepping into this role. Along with that, from staffing perspective, we do still have a vacancy for a 2-day-a-week position. That's been hard. I've been trying to fill that. And we've had a couple of staff members out on a leave, so we've tried to increase our substitute nurses. We have 2 new ones that we brought on this fall. There's a whole sort of process. School nursing is just unique, so it doesn't really matter how long you've been a nurse or what kind of a nurse you are. There's a certain process that has to be brought on, even for somebody who's going to sub, a day a week, every other week. So we've been trying to increase to have a solid pool of sub nurses that can step into any different role. So that is going well. I have another one who's looking to start in January. One thing I was going to mention back in the October meeting, it feels so long ago now, but in the first few weeks of school, we actually had 4 cases of varicella. I've been a school nurse for 10 years, and I've never had a student test positive and report to me they have varicella. So that was interesting. We haven't had any since then. Those cases weren't connected. Well, one was a sibling, but otherwise they weren't connected. But we haven't had any since then. For the immunization clinics, since the last Board of Health meeting, we've had an additional 7 flu vaccine clinics, including 3 evening clinics. We've administered approximately 30 COVID vaccines, 100 flu vaccines, and several childhood immunizations. We also have been continuing the homebound vaccination program. That's really a lovely program, I have to say. The Fairfield residents that have been able to participate in that have really been thankful that, while they might not be able to leave their homes, others can come into their homes and bring flu with them. So they've really been very appreciative of that program. For staff meetings, back in September, we talked about communicable diseases, which is timely with the varicella cases and some other topics relevant to opening schools. October, we had a great meeting. It was one of our discussion meetings, so the topics were submitted by the nurses. We talked a lot about protocol for handling frequent but not medically necessary visits. We have a lot of data that the nurses have been collecting, which is really helpful for me as the new supervisor, so I could really contrast this September to last September. And the nurses were expressing to me like, oh, we are so busy, but they were 20% more visits in the month of September than for this year than for last year. So we had a productive, I think, meeting talking about some ways to minimize the non-necessary, the ones that are really trying to get out of class or those things, and how to, schedule around those. I'm trying to remember the other topics. Things to do, we reviewed some things to do in lockdown visits, and then statistics and the statistics that the nurses are keeping to make sure we're sort of all keeping similar data. I intend to look at that data again, but it does look like we've returned more to a normal average number of visits. But November's a weird month, so we'll see how it goes. November, we had an all-day professional development day with some great presentations. Jessica Bloomberg is a social worker who's embedded with the police department. She talked to us about what she does. I think that was really helpful for the nurses, especially when you have a family who maybe doesn't want to involve the schools more, knowing that resource was out there. Lieutenant Wiltsey updated us on the school resource officer program. We had a state epidemiologist update and review with the nurses on pertussis. Dr. Miriam Cohen talked to us about pediatric rashes, everyone's favorite, always come into the nurse's office, and when is it, you got to get out of here, and when is it not such a big deal? We could have you come do that probably. And Dr. Paul, yeah, and Dr. Paul reviewed concussion management and assessment. So that's some of what we've been doing. It's hard to sum it all up in 3 months. I have started reviewing some of the policies that are in our manual and talking with SANS. I don't have one to present today, but I imagine having some forthcoming that I'd kind of like to look at and revisit, new eyes, new time to look at the policies and some of how we manage things. I feel like I'm trying to think if I missed anything. It's been a busy, but really I've enjoyed the first 3 months. Like I said, I do feel like I have a great group of staff. I have the 2 nursing coordinators who really have been juggling a lot to manage some of the scheduling. If you look at this board and overlap and where everybody goes and move this from here to there, it's quite a puzzle that puts together, and we've had some challenges, but we've done great, and I'm happy to be here.
Good.
Awesome. Happy to have you. Thanks.
Yeah, that's great.
Thank you, Sarah.
I'm curious, are there any ratios for kind of workload balance that the state mandates on school nursing?
There aren't. It's a great question. I wish there were. When I was getting my master's, I remember writing a few papers about this, and they had floated one nurse for every 600 kids as an idea, and then they said, unless you have a child who has diabetes, which I feel like we don't have at every school, but almost, or a child with seizure disorder or medical intervention. So it's kind of a hard, there's really not. I do think the staffing ratios here in Fairfield are pretty good. Like I'm pleased with the ratios that I've inherited, but that doesn't mean that you can't have days that feel, it's like staffing an ER, right? Like you can have days that don't feel over the top, and then days that you're like, how did I make it through? But thanks.
Awesome. Thank you. Any communications?
I have none.
Same. Just a bunch of fake ones still.
Oh, boy.
Yeah. Any old business to bring forward?
We have none.
Any new business?
I have none.
Same. Okay. I'll take a motion to adjourn the meeting.
Hey.
We have one by Mark. Is there a second? Second my motion. Or Mark's motion, rather. Any opposed? All right. Hearing none. We are adjourned at 8:08.